Barth syndrome from the National Organization for Rare Disorders. The type of disease. It's a rare metabolic and neuromuscular genetic disorder that occurs mostly in males, passed from mother to son through the X chromosome. The typical onset usually becomes apparent during infancy or early childhood, but the age of onset and the course of these diseases differs. Characteristics of the syndrome: abnormalities of heart and skeletal muscle, low levels of certain white blood cells that help fight bacterial infections, and growth retardation, increased levels of certain organic acids in the urine and blood, increased thickness of the left ventricle of the heart. What gene is responsible? It is passed on as an X-linked recessive trait. A gene responsible for the disorder has been located on the long arm of chromosome X at XQ28. Symptoms. Most with Barth syndrome present with weakened heart muscles that leads to the enlargement of the heart's lower chambers. This is known as dilated cardiomyopathy. Heart failure is also a symptom, but may show up differently in each individual person. Symptoms continued: abnormally diminished muscle tone and muscle weakness, which often leads to delayed acquisition of gross motor skills. Infants and children affected by Barth syndrome may fail to thrive, fail to gain weight as expected. They may have mild learning disabilities but normal intelligence. They may be prone to recurrent bacterial infections. Affected populations affects all ethnic groups. Incident rate to be somewhere between 1 in 200,000 to 400,000 births. May be underestimated since many cases of Barth syndrome go unrecognized and unreported. Diagnosis. Based upon a thorough clinical evaluation, identification of characteristic physical findings, a complete patient and family history, and a variety of specialized tests. Also, metabolic screening tests, including studies to measure levels of 3-methylglutaconic acid and other organic acids in the urine and blood. Treatment. Treatment is for the specific symptoms of Barth syndrome. Diuretic and digitalis medications to treat heart failure. Antibiotics used for bacterial infections. Prognosis. The evidence suggests that many affected children with Barth syndrome later in childhood are removed from cardiac therapy due to improvement of heart function. Historically, boys died of heart failure or infection at 3 years of age, but with improved diagnosis and appropriate medical treatment and monitoring of all symptoms, the survival rate and future of these individuals is much brighter.